Here we are in Celomed Clinic. This is a private medical, oncological and integrative center. Can you tell us if nanothermia exists in other countries and hospitals, public or private abroad?
Yes. So this method which we have developed, it has really a very wide range applications. We have over 30 countries presently. Among the applicators, we have more than 400 installations, and it is applied in governmental, university and private clinic. Private university.
We are before the device of nanothermia EHI 2000. Why the base of distilled water, and in the device there is a circuitry also. Is this a kind of isolation for the patient?
No. So presently this works like a specialty that the patient is an electric part of a resonance circuit. Patient is in between the two electrodes, and the distilled water is a radio frequency conductor. So it means that this is not an isolator at all. We would like to have current, so radio frequency current. The main trick electrically is that one, that the machine has such a tuning, auto-matching system, which makes resonance of that one, that these isolators are looking like conductors. In this value, the patient is a part of the circuit, so it means every change which is in the patient, that is immediately sensorized by the machine and corrects the most optimal.
What is the temperature that is reached inside the tumor?
This question has to be somehow divided in two parts. At first, our aim with this method is to heat up the tumor cells selectively, and on the tumor cells, the membrane, the transmembrane proteins are excited especially. We publish the results that more than 40, sometimes 43, 45 centigrade is reached in the nanoscopic range of the membrane. This selective heating is exactly chooses the malignant cells, and the total tumor is not heated so much. The total tumor heating is about 38, 39, but absolutely under 40. I tell you why 40 is the limit, is the threshold. Over 40 we have very large blood flow, which would like to cool down the heating of the tumor mass, and the blood flow works against us, because the blood flow supports the tumor with glucose, plus the blood flow takes away the malignant cells, makes metastases. So the selection, tumor specific selection, is absolutely important in this method.
What is the temperature in the surrounding tissue?
The surrounding tissue is not heated almost at all. So the tumor itself is under 40, the surrounding tissue remains body temperature, sometimes half centigrade or 1 centigrade higher.
Can we say that this is the selection that treats the tumor nanoscopically in the interior of the tumor without altering any other kind of tissues?
Yes. It's really, that is the aim. So we are doing the current, which current selectively choosing only the malignant cells and nothing else.
What is the impact that the electromagnetic energy produces in the cancer cells?
The main impact is heating up the membrane clusters, which we call membrane rafts, and the membrane raft starts a very special signal. We call it apoptotic signal or programmed cell death signal, and by this programmed cell death, the tumor cells are killed.
Modulation is a unique system that is patented. What is the importance of this system?
The modulation is one of the most important points of all the method. We have a frequency 13.56, which is a free frequency, 13.56 megahertz, which is a free frequency by the post office for any medical use. And this one is modulated with the fractal modulation in the time dependence on the same way, which causes the best results for apoptosis in the cells.
Is it a safe and non-painful treatment for the patient?
Yes, it is a very safe and no side effects treatment, or very small number of side effects. The side effects mostly in about 3% skin redness, which we have.
It seems that nanothermia is a tool for the treatment of cancer that has been recognized in many countries and medical centers and even hospitals. But in Europe, where can we say that it is used more commonly?
Yeah, in Europe, unfortunately, not so much used, even not hypothermia and not nanothermia or oncothermia. Somehow in Europe, the classical treatments are much more common and much more accepted, but it's started really a very new era of the nanothermia everywhere in Europe as well. We have a full approval in the EU about the method, and just now Germany, of course, applies it very extensively, but we have many other European countries which are using this method as well.
Could you tell us how many centers in Germany are applying this therapy?
In Germany, about 150 installations we have, which is really very large, but you know that this was the starting point, so very simple telling, this is a German medicine because it was worked out in Germany.
Now, what about Asia? We know that Japan, for example, is known for being top in technology, and important groups of investigation are doing this in universities and hospitals. What is the place of nanothermia in Japan and in research aspects in this country?
Yeah, I think it's a very important area of the treatment because of the high population and very high level technology. The largest number of applications we have in South Korea, where we have more than 100 installations in more than 20 universities also, which is really very high number. And we have, of course, in Japan, how it's interesting that in Oncotherm company, Japan has a share part with 6%, which means that they are so interested for the method that even sharing the production.
We know about Canada, Australia, South Africa. Can we say that this therapy is in the 5 continents? How many patients are treated annually in the world with nanothermia?
Annually, we have calculated that more than 200,000 treatments are made with the devices. How many patients it covers, it's not so easy because patients have different number of treatments. But a very large, very huge number of patients. And we are very happy that the feedbacks which we have very positive.
Professor Szasz, we thank you very much for your explanation, and we expect this important technology offered by Settlement Clinic to their patients be extended to many other centers and hospitals in Spain, so we can help a larger number of patients with cancer. Thank you very much for your participation.
Thank you very much, and wish everything the best for the patients and for you.